President.
Senator from Texas.
President, ask unanimous consent that the quorum call be rescinded.
Without objection, it is rescinded.
Mr. President, this morning's decision by the United States Supreme Court has clarified some things and has made other things more muddled. One it has clarified is the importance of the upcoming election on November the 6th, 2012. The only way to stop the overreaching by the federal government, including the President's flawed health care bill, is to elect a new President and a Congress that will repeal and replace this fundamentally flawed law. Before the health care bill became law, the President repeatedly assured the American people that he would not raise taxes on the middle class. He declared emphatically that the individual mandate was, quote, absolutely not a tax increase, close quote. But the Supreme Court of the United States has made absolutely clear that the only way Obamacare can be upheld as within the constitutional power of Congress is for it to be considered a tax increase, and a tax increase on every single American, regardless of income. The President also told us his health care law would reduce premiums by $2,500 for the average family. That was another broken promise. Last year, the average American family with employer-sponsored insurance saw their premiums rise by $1,200. The case against this health care legislation is very simple. It relies on massive tax increases, job-killing regulations, and government coercion. It will place Washington bureaucrats between patients and their doctors, and it will cause millions of Americans to lose their current insurance coverage. So much for if you like it, you can keep it. And as we now know, Obamacare has made the problem of rising health care costs worse, not better. So for these reasons and more, we need to repeal this entire piece of legislation and start over. We all share the goal of expanding health care coverage, but there are good ways and bad ways to do it. The authors of Obamacare chose a fundamentally flawed way, yet another government takeover. I think perhaps one of the most telling things that Congress has done in the last few years is pass a bill under Medicare for prescription drug coverage for seniors. And rather than a government-run program, we created a marketplace for competition where prescription providers can compete for consumers' favor by improved cost or lower cost and better service. And indeed, by using the discipline, the cost discipline of a market, of a consumer-oriented approach to health care, that government program came in 40% under projected costs. Now, that's the only time that I know of in the health care field where the government has actually created a program that people like that's come in significantly under cost. We cannot continue to cut health care payments to providers because fewer and fewer providers are simply going to provide that service. We know that's true in Medicare, where many seniors can't find a doctor to take them as a patient because they won't accept Medicare's low reimbursement rates. We know it's even worse for Medicaid patients because Medicaid, that government program, pays providers a fraction of what they would be paid if they were simply covered by private insurance. All Americans should have access to high-quality coverage and high-quality care. The best way to make quality coverage and care more accessible is to reduce the cost. Obamacare increases the cost. We need to reduce the cost and make it more affordable. And the best way to reduce costs is through patient-driven reforms that increase transparency, eliminate government distortions, and boost private competition. Those are the reforms that Americans want, and those are the reforms that they deserve. Unfortunately, President Obama has made clear that he views health care reform as a vehicle for expanding the size of government and its intrusion into the decisions that should be reserved to patients in consultation with their private doctor. Time and time again, the President has put ideology ahead of basic logic and sound economics. Therefore, and to ensure that future health care reforms empower patients and reduce costs and make it more affordable, we need to put a new president in the White House. I yield the floor.
Madam President.
The senator from Iowa.
Madam President, as chair of the Health, Education, Labor, and Pensions Committee in the Senate, the committee that drafted large portions of the Affordable Care Act, and looking back at all of the hearings we had, the long markup sessions, working across the aisle with Republicans, working with the administration, finally getting it passed, signed into law. This is a great day. There has been a cloud hanging over it because of those who don't want to reform the health care system. They wanted to keep the insurance companies in charge. Well, we said, no, we're going to change the system. We're going to reform the system and make it work for people, not just for insurance companies. Well, there were those out there that didn't want to change. They didn't want to reform the system. And so they brought cases in courts, and as we know, it wound its way through the courts, some deciding yes, some deciding no, and went to the Supreme Court. I remember being there this spring for the arguments on this law. and we have been waiting since for the Supreme Court to make its decision. Well, this morning, the Supreme Court gave a resounding confirmation that the Affordable Care Act is indeed constitutional. Now, some have been saying that President Obama wins on this, or the Democrats win, or Republicans lose, that kind of thing. I don't see it that way. What I see it as is a great victory for the American people, for the businesses of America, for our economy. That's what this is all about. It moves us forward so that every American, every single American, will have quality, affordable health care coverage, something we've never done in this country. That's why this is such a landmark bill and such a landmark decision by the Supreme Court. The Supreme Court's decision allows us to move ahead, replacing what I've often called a sick care system, a system that will maybe get to you, if you're lucky, in the emergency room if you're sick, but not one that gets to you before to keep you healthy. That's what the Affordable Care Act is moving towards, a system with more preventative health care, more promoting of wellness and keeping people healthy in the first place by giving them the coverage that they can use to access preventable, affordable wellness and preventative health care. The Supreme Court's made it clear, what we've known all along, that those who want to block this law and who are now clamoring to repeal it, they are on the wrong side of history. They are on the side of history that you could go all the way back, that didn't want to have a Social Security system. There were those. They were on the wrong side of history. There were those who didn't want to have a Medicare system. They were on the wrong side of history. Those who want to repeal this law can stand with them. They can stand with them in history. But I think history has shown that every time we expand rights of people to certain basic things that people need in their lives, that we become a stronger country, a more unified country, a better country, with more opportunity for all. For those of us who believe that quality, affordable health care is a right and not a privilege, this is a great victory. So now I see that some in the House have now scheduled a vote to repeal it after we get back from the 4th of July break. Well, they've already voted to repeal it. I guess they're going to vote to repeal it again. They're on the wrong side of history. And you know, I call upon my Republican friends in the House and in the Senate. It's over. This is constitutional. Now let's work together to make it so it's implemented, that it works for everyone. I say to my Republican friends, I've never said that the Affordable Care Act is like the 10 Commandments chiseled in stone for all eternity. I've often likened it to a starter home, which could add some additions, make some improvements as we go along. But at least that starter home has put a roof over our heads, a roof that will get quality, affordable health care insurance to every American. So I say to my Republican friends, bring your toolkits. Bring your toolkits. If you want to make it better and improve it, bring your toolkits. Don't bring a sledgehammer. Don't bring a sledgehammer to break it down and try to repeal it. That's a non-starter. So let's work together, put politics behind us, and make this bill work for everyone. Make it work for every American. The justices have spoken. Now it's time for us to get back to work, to build a reformed health care system that works not just for the healthy and the wealthy, but for all Americans. This is a victory. It is not a victory for President Obama. It is not a victory for my committee or anyone else around here. What this is, it's a victory to make sure that no one in the future is ever denied health care coverage because he or she got cancer. Make sure that no one in the future will be denied quality, affordable health care coverage because you had diabetes. It's a victory for families who have had a child that needed intensive, very expensive health care coverage to make sure that that child would live and grow and be able to take full part in our societies. Sometimes those costs are extremely high. In the past, there have been annual limits. Annual limits. If you go above that, you've got to pay out of pocket. Or lifetime caps. How many women have I met in the past who have had breast cancer and had to have intensive treatments for a period of time, but they bumped up against a lifetime cap and they couldn't pay above that. They had to pay out of their own pocket. So this is who it's a victory for. It's a victory for families so they don't face lifetime caps and annual caps. It's a victory for every family in America to ensure that their child can stay on their family's policy until they're age 26. That's who wins here. Ordinary, hardworking families in America. It's a victory for hardworking families to make sure that insurance companies have to provide cost-effective, life-saving, preventative care at no cost to get to people early on to keep them healthy in the first place. It is a victory for working families, so no longer do they have to choose between paying for health insurance or other critical family needs like food, shelter, transportation, education. That's what this is about. That's what this victory is all about. Not one person. It is a victory for America's families. And I say to those who now want to repeal it, who are going to start to make a political issue out of this, you're on the wrong side of history. The American people will now begin to take a look at this bill in a new light, that it is constitutional, it will be implemented, and what's in it for us. And I just went through what's in it for every American family. And American people will not want to go backward. They will not want to repeal this law. There may be improvements that we can make as we go along. That's fine. But I say woe to those who vote to repeal this bill. The American people will hold you accountable for being on the wrong side of history, the wrong side of progress, the wrong side of ensuring that every American family has quality, affordable health care in America. Madam President, I yield the floor, and I note the absence of a quorum.
The clerk will call the roll.
Mr. Akaka.
Madam President, I ask that further proceedings on the quorum call be dispensed with.
Without objection.
Madam President, I ask unanimous consent that Chris Ledoux, a detailee on Senator Johnson's Banking Committee staff, be granted floor privileges for the remainder of today's session.
Without objection.
And Madam President, I note the absence of a quorum.
The clerk will call the roll.
Mr. Akaka.
The senator from Louisiana.
Thank you, Madam President. Madam President, if necessary, I ask unanimous consent to vitiate any quorum call.
Without objection.
Thank you, Madam President. Madam President, I come to the floor, as many of our colleagues have done, to talk about this very significant and, for me at least, really stunning U.S. Supreme Court decision on Obamacare. First of all, I use the word stunning not particularly because of the outcome. I really wouldn't have been shocked at either outcome, upholding the law or striking down the law. I really considered both of those clear possibilities. I am stunned and shocked, somewhat confused by the decision, by the nature of the decision, by the nature of the majority, and by the reasoning. I'm not going to dwell on that. It's not my or other senators' role to second-guess it or to claim we have some authority to rewrite it. But I do find it doing backflips beyond the significant power of the Court to completely recharacterize the individual mandate and parts of the law associated with it as a tax. It was never proposed as a tax. It was never debated as a tax. It was never written as a tax. It was never meant as a tax in any part of the Obamacare debate or legislative action. So I certainly agree with Justice Kennedy, who said out loud from the bench, which I think is significant, that to read it, quote unquote, as a tax is not just reading the law a certain way, it's rewriting the law. And judicial rewriting of tax policy, judicial writing of the law to create a tax is particularly worrisome. I absolutely agree with that. So I really do think the majority, led tragically by Chief Justice Roberts, did backflips to rewrite the law in order to uphold it. And I think that's very unfortunate. What it also means for the country and for the policy debate and for us in the Congress is at least two things, which I think are also very, very important. Number one, it means that if this is a tax, this is a massive tax increase on the middle class, which stands full square against the clear and repeated campaign promises of President Obama. So this is a huge tax increase now that it's a tax, completely against everything he ran on and what he said over and over and over campaigning for office. It also means something separate that's very significant. It means if this is all about taxes and spending, it means a different Congress next year, hopefully led by a different president, can repeal all of that, including with a simple majority of votes in the Senate through reconciliation. If this is all about a tax, if it's all taxes and spending, then it can all be undone through the reconciliation process. And of course, that's significant for one reason and one reason only, because here in the Senate, it means that lowers the requirement from 60 votes to a simple majority. With a Republican president, that would be 50 votes plus the vice president as the tiebreaker. So, Madam President, my bottom line is simple. It was my bottom line yesterday before the opinion. It was my bottom line for over the last several months. It was my bottom line the day after Congress passed Obamacare and the President signed it into law. It may be ruled constitutional. It's still a bad idea that is making things worse. It's putting an all-powerful federal government between the patient and his or her doctor. And it's costing us an enormous amount of money as individuals, as citizens, as a society, as a government that we clearly cannot afford. Many of us made those arguments during the original debate, but I think all of those arguments have been validated and are even more clearly true and compelling in the months since Obamacare was passed. In particular, costs have been going through the roof. And the suggestion that this was going to save us money and not cost us extra money, even the suggestion, the argument has gone out the window. It's clear the opposite is true. Individual premiums have gone up as a result. Family premiums have gone up as a result. Costs to the government and to society have gone up as a result. It's made the already staggering problem of health care costs worse and worse and worse. It's made health care for everyday Americans less and less affordable. And because of that, I certainly renew my commitment to work with others to fully repeal Obamacare, lock, stock, and barrel. And under the Supreme Court's decision today, again, I restate, I think it's very significant since it's all about a tax, since it's all about taxes and spending. That can be done early next year with a simple majority in the United States Senate if there's a President Romney and a Republican Congress to do it. Thank you, Madam President. I yield back the floor.
Roll.
Mr. Kaka.
Madam President.
The senator from Rhode Island.
Madam President, in light of the, first of all, may I ask permission that the pending quorum call be lifted?
Without objection.
Madam President, I wanted to, in light of the Supreme Court's decision on the Affordable Care Act, come to the floor today to bring just a few Rhode Island voices into the discussion that is taking place. One is a man in Providence, Rhode Island, named Greg, who has a 16-year-old son. His son is named Will, and Will has cystic fibrosis. That requires Will to spend several hours every day undergoing the treatment that dreadful disease requires. He sees a specialist 4 times a year to monitor the disease. He has daily prescriptions and treatments. And Will and his father, without this bill, we're looking at 2 problems. 1, denial of coverage because Will's cystic fibrosis was a pre-existing condition. And 2, lifetime caps. For people like Will all around the country, this has been a real blessing because lifetime caps are forbidden and kids with pre-existing conditions must be covered, notwithstanding the pre-existing condition. So from Greg, the father in Providence, and his son Will, I wanted their voices to be heard today in not so much celebration as relief that what they have been provided by the health care law is still in place. Another voice to bring to the floor is Olive. Olive is a senior citizen. She lives in Woonsocket, Rhode Island. Her husband has fairly serious Alzheimer's disease and requires several medications to treat it. Until the Affordable Care Act came along, Olive and her husband fell into the donut hole, and they had to pay 100 cents on the dollar for the husband's Alzheimer's medications while they were in the donut hole. When I ran for this office, one of the things I pledged to do was to work my heart out to close that donut hole, and in the Affordable Care Act, we do close it. It closes over time, and where we're at right now is that there is a 50% discount for Olive and her husband on her husband's Alzheimer's drugs when they're in the donut hole, and to them, that 50% discount meant $2,400, which for senior citizens counting on Social Security in Woonsocket is a very, very significant difference in the quality of their lives. Overall in Rhode Island, it's up to $13.9 million in donut hole discounts for seniors and people with disabilities as a result of this bill. That makes a big difference in every single one of those lives, just like Olive and her husband. A third voice I'd like to bring is Brianne, who is a 22-year-old graduate of the University of Rhode Island. She is out. She's working part-time as a physical therapist, but her job does not provide health insurance. She would be going without entirely, hanging her fortunes on chance, as the President recently said, if it were not for the Affordable Care Act. And she and 7,500 young adults in Rhode Island have achieved coverage as a result of this bill by being able to get on their parents' policies. Danny is also a recent college graduate living in Providence, having graduated from Brown University. He is passionate about renewable energy planning, but couldn't make the health insurance work. And because of the Affordable Care Act, like Brianne, he's able to be on his parents' health insurance coverage and have that peace of mind. The last story I'll tell is of a small business owner named Jeff in Providence who provides health care insurance for his employees because he believes it's the right thing to do. He qualified for the law's small business health care tax credit, and so he has seen significant advantage to his small business from this provision. So I think it's a relief to try to put this quarrel behind us, to be able to move on and deal with the economic issues that we face. But that as we do, I wanted to make sure that Greg and Olive and Brianne and Jeff and Danny were all heard here on the floor today, because they are Rhode Islanders in whose lives this bill has made a real and practical difference. I thank the presiding officer. I yield the floor, and I note the absence of I will not note the absence of a quorum because I see the distinguished senator from Wyoming ready to take the floor.
Madam President.
The senator from Wyoming.
Thank you, Madam President. It is disappointing that the Supreme Court has